Okay.
Okay, gracias.
Perfect. Okay, so for our first question, we wanted to ask you if you could tell us a little bit about yourself, any mo significant moments in your childhood, education, or any other relevant information in your life.
As you know, my name's Jaime Patiño. I'm on the board of directors of Traversio Vasquez Health Center. I've been on the board since, I believe, 2013. And I'm also a councilman here in Union City. I'm on my second term, 6 years I've been on. And I grew up here in my barrio here. It's called Decoto. And the Versio Vasquez actually opened in 1970, 1 block from my house. So I grew up with it here in my neighborhood, a block away. Um, when I was little, my mom passed away when I was 10, and my brother was 5. So my grandparents raised me, and so things weren't always economically. Well, I would say, looking back, we probably were poor. We just didn't know it because we were with everybody else in the barrio. So it was we had a good upbringing, but Tiburcio was always there. We always knew that if you ever needed something, Tiburcio was there for you, for us, in the community. So as I got older, I had my daughter, and I got financially stable. I said, you know what? I want to give back to an organization that's given so much to us here in this community. So I asked if there were any openings on the board, and there were. So I applied, and I've been on the board ever since. And we've done a lot of great work here in the community.
Okay, that's wonderful. So I know you said you've been on the board for about 13 years. Could you describe a little bit more about like the whole process of becoming involved with the board, or what other factors also influence to make you want to be more involved with Tiburcio Vasquez Health Center?
Well, um, healthcare has always been something that I've always been interested in. I currently work in finance for Kaiser Permanente, and so I have that as my professional side, but I also wanted to do more to help people that are um, at the other end of the economic spectrum, people that have chronic conditions, people that get forgotten by society sometimes, and I wanted to give back, and so when I asked if there were any openings, they said yes, and I learned so much. I knew Tiburcia was there. And I had been there as a kid, but I really did not know how they operated, what their funding mix was, the challenges they face. We just always assumed it's there, it's a resource, it's always going to be there. But there are some years where funding is very precarious. So I'm glad that I've been on the board, and I've been able to go and advocate at the state and federal level to make sure that the funding continues to come in for the FQHCs. And a lot of people don't realize this. FQHCs have bipartisan support because they're not just here in the Latino neighborhoods; they're out there in rural America and the Midwest, and so that's the only healthcare for hours.
Excuse me,
You
what
know,
is HLC?
uh,
What is that acronym that you use? Can you
no,
explain?
FQHC. It's a federally qualified health center.
Ah, Federal Qualified Center. Okay. You are
It's a, did you catch that? Was
something is we didn't get it because you get uh free in the camera.
oh, can you hear me now?
Yeah.
Okay, so a federally qualified health center, Tiburcio falls under that, and it's a hold on. Well, so it was they were designated in 1989 as federally qualified health centers, but community health centers actually started back in 64 with Johnson's War on Poverty. But FQHC, like Clínica de la Raza, what's it, Native American Health Center, those are all what are called FQHCs. So Tiburcio was one of many. I believe there's 126 FQHCs in California.
How many? No,
126.
no, so, can you repeat?
One There are 126 federally qualified health centers in California.
Wow, wow.
So it's come a long way. It's come a long way.
Yeah, I can see that. Did you have some information about that?
Um, well, I know that they came out of the President Johnson's war on poverty back in '64. And they were really pushed during the civil rights movement because a lot of minorities did not have health care in their neighborhoods. So these federally qualified health centers actually expanded access to health care for Latinos, African Americans, and other minority groups that typically did not have access to health care. It was a civil rights issue back in the '60s.
Yes, it is.
Aside from other movements going on around the country at the time, do you think there was any unmet community needs that the Tiburcio Vasquez Health Center was helping meet, maybe at the time that you joined the board, but also during the time of founding?
Definitely. This area down here
Mm-hmm.
was still an agricultural area. We had some industry, we had some housing, but we still had a lot of orchards, peaches, apricots. We had nurseries. We had gladiola fields over by the hills. So that we had a lot of campesinos, a lot of farm workers here. So
Mm-hmm.
Tiburcio Vasquez was the health center for these people and their families. So it was really needed back then. It's evolved because we've become more urban, but the need is still there. We still have a critical need. We still reach out to a lot of people that don't know about our services or think that they're not able to access our services, because we're named Tiburcio Vasquez. We have Asian Americans, uh, Afghan Americans, African Americans that think they can't access our services. We're open to everybody.
Mm-hmm. Okay, that's wonderful. Okay. So for our next question, we want to know if you could give us a little bit of more insight on Decodo, like the community members, what type of community it was, and why it was so crucial to place Tiburcio Vasquez in Decodo rather than another city in the Tri-Cities area.
Well, when Tiburcio opened, I believe it was 52 years ago. Um, this was probably about 80% Latino, this neighborhood. And we had a lot of health issues back then. Um, as I said, we had farm workers working in the fields, getting exposed to pesticides, things like that. We had,
Mhm.
and we still have it, kids with asthma, type 2 diabetes, and we didn't have any healthcare nearby. If you got sick, you probably couldn't see a doctor until it was actually to the point where you had to go to the emergency room. And we all know that that's not a very efficient way to use our healthcare system. And
Mhm.
so it was needed here. And the health center, like I said, opened right here about 52 years ago on
Mhm.
Ninth Street. And we've actually expanded. We have 3 clinics now. We're based in 5 different schools. And then we have 2 pediatric clinics in Hayward. So the need is there. We we see roughly about 9 or 10,000 patients a month. So the need is still there. And as this neighborhood has evolved, it's probably only about 60% Latino now. It's kind of gone down, but the numbers are there, and we're not just treating Latinos, we're treating everybody that needs care. We don't turn away anybody. Um, so this was a hotbed here in the '70s. We had Cesar Chavez who came here a couple of times to speak. Uh, we had actually back then in the '70s, we actually had riots in the streets between the residents and the police.
Mm-hmm.
I don't know if you're aware, but in 1974, um, the police killed a Dakota resident. There were riots. They had a big meeting with the chief and everybody, and the chief was assassinated here back in 1974, William Cann. So this was a hotbed in the 70s for the movimiento and for healthcare. Healthcare was right there. Healthcare was a basic right that was not being uh, not that a lot of people here did not have access to.
Yes, I understand.
You,
You
you are,
touched base on,
he's
no,
frozen.
go ahead.
Okay.
What was that?
You get frozen again.
Oh,
No,
did,
yeah,
did
we
you get the
did.
whole part there? Okay.
We got the part. But you said that it was a chief of police that was dead. Just to be sure that we have
He was
it.
assassinated here, right around the corner, actually, 1 block from the clinic at the church. He was there for a community meeting after the police killed a Dakota resident, and he was shot and killed.
Wow, wow.
Yeah.
And it was the when the movement of the Cesar Chavez and the Black Panther, all of this influenced that.
There was a lot, yeah, you had a lot of stuff was going on at that time. This was 1974, so this is right out towards the end of the civil rights movement, but we still had the Brown Berets that were very active in this area. We had a lot of stuff going on, and healthcare was one of the issues that people were fighting for back then, and
What
the
do you,
lack of access.
what do you think in the way the you said it, but I wanted you to be more precise. What beside the disease, what moved the movement for healthcare? Because this is not clear in many others interview that we have.
The it started with the war on poverty that Johnson started back in 1964, and part of that war on poverty was not everybody has equal access to healthcare, and especially minority groups, they don't have equal access to healthcare. So that's where the community health centers came about. You know, places like Delano, where you had the farm workers strike at that time. Places like here in Dakota, where we had a lot of farm workers working, and they didn't they were supplying food for our tables, but yet didn't have basic health care for themselves or for their families. So that's that war on poverty rolled into the civil rights movement of the late 60s, early 70s, and then was further pushed in 1989 with when actually community health centers were declared, many of them were declared federally qualified health centers. So it's been an evolving uh, or an evolving organization, not organization, but movement to from where they just maybe a couple doctors and basic healthcare to now we offer dentistry, we offer optometry, podiatry. We're as our population is getting older, we're offering geriatrics. It's a full service health center now, and it started with the war on poverty, the civil rights movement, all the way till now.
Nice. Thank you.
Okay, you mentioned the Brown Berets, and I'm aware that they've been really influential in communities, stepping up to the role and really aiding the community. I was wondering if you could expand on how the Brown Berets helped the founding of Tiburcio Vasquez Health Center.
I wouldn't say they had a direct influence, but
Mhm.
they were part of a movement at the time, uh, fighting for equal rights, equal access to education, to
Mhm.
jobs, and to healthcare. Because it all starts with healthcare. If you don't have good healthcare, how are you going to succeed in school? How
Mhm.
are you going to get a good job if you don't have the basic health care? So that was all encompassing. They did not have a direct role in the founding of Tiburcio, but
Mhm.
we were all going in the same direction at that time.
Yeah.
So we all complemented each other.
Mhm.
Nice.
That's perfect. And now fast forwarding to where Tiburcio Vasquez is now. I know you mentioned they expanded to various clinics across the Tri-City area. And I was wondering if you could if you could describe any information as to why Tiburcio Vasquez felt the need to expand outside of Decoto and like who, if there was any organizations that helped in this process as well.
Yeah, well, we expanded because the need was there. It wasn't, if you look at the clinic here in Decoto, it's a very small clinic.
Mhm.
It's 2 stories. If you see our other 2 clinics, they're probably double the size.
Yeah.
But the need is there. Hayward is a largely Latino city, and there's a definite need there. Uh, if you look at our newest facility there in San Leandro, it's actually outside of incorporated, it's unincorporated San Leandro, the Ashland area, that is probably about 85% Latino there.
Mhm.
And they did not have access to healthcare. So that we've expanded where the need is. And we've had good partners. Fremont Bank has done a great job of supporting our efforts to expand and engage with populations that just have not had real access. Their only access to healthcare would be going to the emergency room, which
Mhm.
by then is very late in the game there. We had good partners like former Hayward Fire Chief Contreras. Uh, he's the one that came up with the idea of opening up the firehouse clinic right there on Tennyson and Tennyson and Huntwood. Was what he was seeing is that in that largely Latino neighborhood there in Hayward, they were getting 911 calls for chronic conditions such as diabetes, high blood pressure that were going untreated, and so they were having to go out there, and then the patient would have to be transferred over to St. Rose, which would clog up. It would tie up the fire department, and it would clog up the St. Rose emergency room.
Mhm.
So what he said is, for these people that we're seeing on a regular basis, let's have them go to the firehouse for their treatment. So actually, technically, that's four facilities we have. So because we have the firehouse clinic, and that was the first clinic of its kind in the country. And I was so happy that that I was on the board when we opened that. So there's a need. There's a lot of people we still aren't reaching out to. We have a program for the last 2 years called Street Medicine, where we actually go out to the homeless encampments and we treat the homeless people there because they have a hard time actually getting out to our offices to make appointments. So we actually go out to them, and we have a social worker that's there with them that gets them access to services or just try to see what else we could do to help them.
And you said the name was street medicine, right? For that?
Street medicine.
Street medicine. Okay.
May I ask you a question, Arely?
Mm.
Um, how was this idea of street medicine came about?
Oh, as you know, California has seen an increase in homelessness in the last decade, and we were getting calls from our fire departments and our hospitals saying that they're coming.
We're losing.
You're cutting out there.
Yeah, can you begin again?
Okay, so we were getting calls from our the fire departments and hospitals saying that we're getting these homeless people that are coming into our emergency rooms and are needing treatment, but these things could have been avoided had they sought healthcare earlier. So things like diabetes, things like high blood pressure, uh, maybe they get an infection which could easily be treated with antibiotics, but since they don't go to the doctor, it becomes a worse issue. So um, that's where, okay, we can't get, it's hard to get them to go into the clinic because of the fact that they're transient. Let's go out to them. And usually when we engage with them, they reciprocate and they're more willing to actually go to the clinic for follow-up treatment. And to seek services to get them out of their homelessness.
Nice, nice, very important. And Arelis, you can continue it. Thank you.
Okay, perfect. Okay, so going back to the expansion of the Tiburcio Vasquez Health Center, I was wondering if there was any problems that came about during the process and how you guys went, or yeah, any like how you guys went about solving these issues.
Um, I wouldn't say problems, just maybe some little bit of roadblocks, and
Mm-hmm.
most of that has been around uh getting all the sign off from the federal government and the state government. They're a bit bureaucratic, and it can take time to get all these sign offs. So that took time, but when you're working with government, you know that that's going to happen.
Mm-hmm.
Um, we actually had there was actually a piece of land here on Mission Boulevard that we wanted to buy from the city. This was before I was a councilman, and we had Fremont Bank that was ready to finance it for us, and the city balked at it because uh, they wanted they knew that as a nonprofit organization, we were not going to pay. Tiburcio was not going to pay property taxes on that, and the city wanted uh, property tax on this. So they wanted to sell it to a for-profit entity. So we've had that was kind of a setback because, as you see, the clinic here in Union City in Decoto is very small, and
Mm-hmm.
we w- we see a lot of people through there, considering how small it is. So, in fact, during COVID, it was an issue because we wanted to keep space between people, but there's not much space there to begin with. So, we had that issue. So, the city was a bit of a hindrance on that one for preventing us from expanding to another facility.
Mm. Okay, you mentioned that space being an issue during COVID. I know we were in social distancing, and obviously, was the clinic open at the time?
The clinic was still open. Yeah, the clinic stayed open. Um, it was actually needed more than ever during COVID.
Mm-hmm.
Uh, one of the proudest moments that I ever had as a board member and as a councilman, I'll say, because I was a councilman by this time, um, was during COVID when the vaccines came out. Uh, Tiburcio was offering the vaccines, but they have a very small parking lot. It was done outside, and so they had the vaccines, but they couldn't get the people through
Mm-hmm.
fast enough because they're just space limitations. Well, a block down the street is Our Lady of the Rosary Catholic Church. And the padre there, he was having issues because he couldn't have in-person services. So you had this huge parking lot, and he can't. They can't have services. They had services outside, but they were very small.
Mm-hmm.
So I got the two together. I said, well, you each have a problem. You need a bigger area to give the vaccines, and you have an empty parking lot. So I got them together. Tiburcio leased the parking lot and did mass vaccinations there, and it was a success. They were seeing probably upwards of about almost 400 people a day. And you had two pillars of the community, the church
Mm-hmm.
and the clinic. And if you remember, Latinos had a very low vaccination rate at that time. But
Mm-hmm.
because we had two pillars of the community advocating for this, we had lines. People were coming, and getting vaccinated. So it was so successful that the Governor Newsom actually came and toured our vaccine clinic, and I had the honor of talking to him for a while, and he did a press conference there, and I told him, look, this is how you get people vaccinated. Don't do the Dodger Stadium vaccination. You're telling people to stay away, keep distance, and you're trying to put them all in Dodger Stadium. That's not going to work. Right here, the community, they trust the clinic, they trust the church. This is where you're going to get the vaccination rates up here in the community.
This is
Yeah.
wonderful. And may I ask you, and when you do the community? You still had to, people had to still make the appointment with the uh, computer, internet,
Yeah, they still had to do that, but a lot of us still went door to door. You know, like I remember my neighbor 3 doors down, Senora De Leon, and she doesn't get out much. So I went over there, Senora, you want to get your vaccination? Oh yes, but I don't feel like walking all the way over there. Well, you know what? I'll take you right now. I know that there's an opening right now. So I took her in my truck, and a lot of it was grassroots. We knew it. We knew people in the neighborhood. We knew, you know, who they were, and we knew that. Okay, they don't have a computer. They don't have this smartphone. So we knew that. Okay, we have so many slots open today that where there's no nobody scheduled.
Mm.
So
or
we
free.
could go out and get 20 people today, or we could get 15 or 30.
That's
Was
one.
that?
Yeah, we got it. That's wonderful
Okay.
because in another setting, in another Latino neighbor, it was so difficult because many elderly didn't know how to go to the computer and make the appointment, and
Yeah.
they have issues.
And, and,
Also,
and one thing yeah, one of our unsung heroes too, one group is our prometoras.
promotoras.
The promotoras were very instrumental in getting the word out, getting people over to get vaccinated. So yeah, I don't want to understate the work that they did because they were out there when everybody was scared about catching COVID. They were still going out there in the community and spreading the word, letting people know what COVID was and what it wasn't. And then when the vaccines came, helping get these people to the vaccination appointments.
They are really a foundation from the health
Mhm.
that case. And I wanted to
Yes.
ask you, there is a a person that ran the promotoras program in the
Um, you know,
or in the community.
I don't remember her name. Schwab Galindo. She could tell you who the person is that runs that program.
Galindo,
Galindo, yeah, Andrea.
Galindo, Andrea. Well, let's continue. Did you?
No, I think I shared her contact info with Areli.
Uh-huh.
Yes.
Yeah. Uh, but continuing, did you were in the clinic when H1N1 was about in um I think it not, but HIV, did you were there?
No, that was a bit before me. That was more in the 80s, late 80s, early 90s. And so I don't really know how that worked. I do know that I can't speak to HIV, but I do know that this neighborhood had a high incidence of hepatitis because our neighborhood uh, had a lot of substance abuse, especially with heroin.
Uh-huh.
So there were a lot of people that got hepatitis. I don't really know much about HIV because you got to remember back then it was something you just didn't talk about
Yeah,
because it was thought of as a homosexual disease. So even if you got it from drug usage, you didn't want to talk about it. So there probably was HIV here. I just was not aware of it because there was a stigma to
yeah.
to that. But people were more open about getting hepatitis than they were about getting HIV. So and like I said, that was before I got on the board too.
And how about H1N1? Uh, like it was calling swine flu for a while. It was the
Yeah,
bad
I
that they
Yeah,
did.
I don't remember us getting many cases of that. So I really couldn't speak to it. Uh yeah, I do know that I do remember COVID because of course everybody did. Um but swine flu not much. I do know that we still have to we're still doing a big education campaign on asthma and diabetes.
Mm.
Especially the kids. Our kids are getting type 2 diabetes at a high rate, and it's the bad food choices, and our kids are way too sedentary. They're not getting up and moving around. Even myself, the last year, I lost 32 pounds. And a lot of it was just getting up and exercising, moving, just, getting my nine or 10,000 steps a day. It could, and that's all I did. I made better choices with what I eat and how much I eat, but a lot of it's education. And sometimes parents, they're stressed out. They're running from this to that to that. They just they give dinner to the kids what's convenient, maybe not what's healthy, but what's convenient. So our prometoras and a lot of other of our staff, they do a great job of educating parents about making better food choices for them and for our kids.
Yeah. Areli?
Yeah, well, I was just gonna say, it looks like the promotoras actually do a lot for the community. Like they really step up for the role for educating, prevention, and access to resources. So I think that's really wonderful that you touched base on that.
Yeah,
Circling back.
we just had a graduation for them this past Friday.
Oh,
Um, no, 2 Fridays. No, two last Tuesday. And unfortunately, I wasn't able to attend because I had other meetings. But
mhm,
they do so much, and
mhm.
we would be in a worse place health wise if it wasn't for them.
Yeah, they definitely do a lot.
Eh,
hmm Circling back to your experience as a community member and board member, I was wondering if you could expand more on how your role as a Union City Council member allows you to push for improved health conditions for Latino communities.
I wear a couple hats, as you see. I'm on the board, but I'm also as councilman. But I'm also on the board of directors of the National League of Cities and with the League of California Cities.
Mhm,
So when I go out there to Sacramento or to Washington D.C. to advocate,
mhm,
um, I'm advocating not just for my city. I'm advocating for my community.
mhm,
And part of that is healthcare. And I happen to be was Thursday and Friday, I was in Napa for a leadership meeting for Cal Cities. And at the same place next door, we had the California Association of Public Hospitals. And if I don't know if you're aware, but a lot of these hospitals, a lot of them have closed because the funding just isn't there. They're getting they're being overwhelmed with all the cases, with all the people coming in, but the state has not been good about reimbursing them.
mhm,
So a lot of them have closed, and St. Rose Hospital right here, which is our community hospital, it's on the verge of closing right now. So I had a good discussion with them. There's about 6 of them that I was talking to there right outside the elevator, and we're
mhm,
talking about the importance of us getting the state and federal funding to keep these hospitals open.
mhm,
So because okay, now I'll tell you my third hat, which is I work for Kaiser. If
mhm,
those community hospitals close, guess where they're going to end up? They're going to end up at the Kaiser emergency room. And it's
mhm,
going to get overwhelmed. So even Kaiser members won't be able to get health care.
yeah.
So it's all interconnected. And being a councilman, I have the luxury of wearing all these hats and advocating for all of it, and it's still totally related to my community.
Yeah.
So I try to get as much mileage out of it as I can.
Mhm.
So yeah, they're all complementary.
Mhm.
Yeah, it is. And I will complimenting you by taking care of your health. You are much needed for the community and for all of the settlement.
Thank you.
No, yeah, of course, you definitely do a lot wearing all those hats and like overseeing the whole healthcare and like all these positions you're in. And I wanted to ask one more question, and it was how your involvement with Tiburcio Vasquez is related to your mission statement.
Well, you know, I tell people this story a lot because it just shows how important Tiburcio is to me. When I became a councilman back in 2018, the board president for Tiburcio came up to me. She said, "Oh, Jaime, congratulations, but I'm so sad that we're going to lose you." I go, "Why are you going to lose me?" She goes, "Well, I don't think you're going to be able to handle both." I go, "Well, right now, I have every intention in staying."
Hmm.
I go, "The work that Tiburcio does is so important. I don't want to leave. As long as I can balance both, you have me here." And that was 6 years ago, just over 6 years ago, and I'm still on the board,
Hmm.
and I've been the chair of the finance committee for 6 years, and I don't plan on leaving. It I see firsthand the uh the good that Tiburcio does. There's a restaurant down the street here called Baldi's, and the waitress was having some health issues, and she said, "Well, I don't know what to do. I don't have health care, and I have if I go, I have to pay out of pocket. I'm going to end up in debt." Hold on. I go, even if you don't qualify for something, they have a very good sliding fee scale. So go and check it out. "Oh, well, I thought you had to be on welfare to be." No, no, you don't have to be on welfare to be there. Just go and check it out. And it ends up she did qualify for health care.
Yeah.
And she was so happy. You should see her now. She looks so much better. But she had some chronic conditions that were going untreated.
Hmm.
And that's what makes me still want to stay on the board. Those stories like that. And as long as I have the energy, I will keep doing it.
Yeah. Yeah.
Oh, yeah, we definitely appreciate your work a lot. I know firsthand Tiburcia has helped me and my family a lot. So yeah, we just want to thank you for all you do for the community as well. Mm.
Well,
Dr. Mantini,
it makes I get so much out of it. I just the feeling of knowing that I'm helping make a difference in whatever way possible. It's self-fulfilling.
mhm.
Yeah. We're like you said, Tiburcio Vasquez come from the community, from the issues, and now you are talking about the lack of funding. Many health community health center pass through this. Have ever Tiburcio Vasquez passed through the uh, really tight finances for working? I don't know how to put this in.
Yeah, when I first started, we actually had we were in bad financial shape. We didn't have the right people in the right places making good budget decisions. So when I actually got on board, we we had, I believe, 4 hours we're going to clear for our payroll. Um, due
Again,
to some belt tight,
we lost what
huh?
you said. We lost what you said from the beginning.
No, I said when I first started,
Uh-huh.
we were in bad financial shape,
Uh-huh.
and um, we were down to 4 hours of cash on hand, which meant sometimes we were not sure if our checks were going to clear for payroll.
Mm.
And now we are upwards of, it varies depending on expenses, but we could range between 160 or 180 days of cash on hand. So we have a good reserve now. And a lot of it was but forecasting a bit more conservatively. Uh, we had a behavioral health department that was that really was not what we do. So we ended up spinning that off to La Familia Counseling Center, which that's what they do. They do it great. They run a very efficient organization. But with us, we that was really not what we do, and we were losing money there. So we spun that off. Um, uh, Community health centers are notorious for no-shows for appointments. You could have upwards of 25, 26% no-shows in one day. That's when you're counting on people coming in order to get paid. that you're not going to make much money that way. So we did some tightening with text alerts, and then same day appointments. If you know 1 out of 4 appointments is not going to show up, if someone comes in off the street and says I need to see the doctor, we can fit them in because we know that 1 out of 4 people are not going to show up. We've actually tightened that down to about 15% now. So we're down to a 15% no-show rate, which is way better than 25, 26%. And we could still, if someone, let's say someone gets really sick, has the flu, and needs to come in, they can't wait 2 weeks, we could still fit them in. So we've done a lot of that. So we've totally churned our finances around. And I'm chair of the finance committee. I go through every line item in that finance report every month. And where I see red flags, I'm on the phone with the CFO. What's going on here? What's going on there? I saw that we paid, this was like 6 months ago. I saw that we paid the garbage fee twice in 1 month. I go, why did we pay that? And it was an accident. We paid for twice. So I said, either we get a refund or they don't charge us for next month. Things like that. So we're in a much better place than we were 12 years ago.
And I wanted to ask the last question, that if you may, I wanted to know why health? Because your profession, obviously, you are a good politician. You are interested in health. That's not a question here, but you can be brilliant in other department, in other justice department, whatever. But why health exactly? It
Well,
seems like it's your passion.
well, like I alluded to it earlier, without healthcare, you can't get anything else. You know, how is a kid going to be able to concentrate in school if they don't have access to dentistry and uh they need a root canal or they have an infected tooth? How are they going to be successful in school if they have all these issues? If they have type 2 diabetes, it's not being treated. How are they going to be successful in getting an education? And then that leads to how, if they don't get a decent education, how are they going to get a good job? How are they going to be successful in their career? Um, Healthcare is the big equalizer in this country. Without adequate healthcare, you're not going to be successful in life. You're not going to reach your potential or reach your version of what the American dream is. So it all starts with healthcare. Without healthcare, you're not going to get the education. You're not going to get the job security or be successful in your career. It all starts with healthcare.
Yeah. And I don't know. Do you have another question, Arelis?
Um, no, not anymore.
I wanted to ask you, this have been really, really interesting. And we have a student that transcribed this interview, and we really are engaged in include the student in this vision of the health for everyone. Of the health is necessary. It's the same what you said. Without health, everything can collapse. You know,
Yes.
even if you treat really well your people. Well, if your neighbor, your county neighbor is sick, you will be sick too. It doesn't
Yeah.
matter that you have the best healthcare, best attention for some group people, but if someone is out of the formula uh, of health in the country will be in bad shape. Like a COVID show. I
Yeah,
want.
you're totally right on that. And another example is if we don't make sure people have at least basic health care, they're going to end up in our emergency room. And when they end up in our emergency room, it's going to cost us 10, 20 times more because now, okay, maybe they had a diabetic stroke or they had a heart attack because their diabetes or their blood pressure wasn't being treated. Now they're in intensive care. Now they have to do these operations or procedures. We're going to pay for it one way or another. If we pay for it with preventative care, it's a lot cheaper than actually waiting until they end up in that emergency room. Because now we have no option. We have to treat that. And it's going to be a lot more invasive, a lot more expensive. What if they get to the hospital and yes, we treat them and we save their life, but now they have to be in a skilled nursing facility the rest of their life. Now we as a society have to pay for that.
But it can be contagious
So
and
one way or another, we're going
it
to pay
could
for it.
endanger the other people, like a COVID, you know?
Yeah,
Can
yeah,
treat one
yeah.
people, but it can be contagious and infect the whole country. That's
Yes.
and it's not a prerogative of the poor, the rich, the middle class. All of us can be subject to an infection, viral infection, and that's why it's crucial. But my question goes to, like I tell you that we want the student, the new generation of professional know this point of view. They had to they had to think, get out the box and think about health as an issue important where they can make difference, like you are doing that. And I
Mm.
wanted, if you wanted to give them some kind of message to continue to be ahead and believe that some changes are possible, other work is possible.
Right, and if you're interested to students out there and people that are interested in healthcare, maybe being a doctor or a nurse or a physician assistant isn't something that you want to do. But there are other jobs in healthcare. You know, I'm on the board of Tiburcio, but I also work finance for Kaiser and making sure that our members get access to healthcare, especially where we don't have a facility. So there are other things you can do in healthcare, and but the main thing is you gotta look after your own health first. You know, it's no good trying to get better healthcare for others if you're not taking care of yourself first and using what you have at your disposal. So if you have, go for your yearly checkups, go for your dental exams. That's all preventative. So you don't end up in the emergency room. There are a lot of options out there, but the main thing is take care of yourself first, and then maybe you want to be in healthcare, but you don't want to be a doctor. There are other things you can do. And one thing that one of the good things that came out of COVID was uh, Pfizer, a lot of health plans, Medi-Cal, Medicare, they looked down on telemedicine. They did not like telemedicine, and because of COVID, it's now normal. Now, if you need to see a mental health care professional, you could have a Zoom meeting with your healthcare professional. You don't have to drive across town or 30 miles to meet with them. You could meet via Zoom. If you caught a cold and you have these symptoms, you don't have to go in the office and risk getting everybody else sick. You just do a Zoom meeting, and then the doctor can prescribe you a prescription, and you go get it. And that's one of the good things that came out of COVID was that telemedicine is now the norm.
Mhm.
And it was something that we should have done a long time ago, but there was a lot of resistance. So healthcare is evolving. It's hopefully it's going to get a lot more efficient, and with efficiency, hopefully it'll be a lot cheaper to administer. And if that happens, then access will get even easier. So I'm optimistic for the future.
Good. Well said.
Very inspirational.
Yeah.
Yeah.
Thank you very, very much. We know that your time, Vareli said that you are very busy man and all your answers tell us that this is the case. Thank you very much. And I wanted to tell you that we are putting this interview and transcribing, but also put it in a public archive. And
Okay.
we wanted that your experience and your testimonial will be heard for new generation and
Oh,
say,
that's great.
si se puede, si se puede.
Sí, por supuesto. And just reach out to me anytime you have any questions or have any follow-up. Just let me know, okay?
Por favor, manténganos en contacto porque esto es muy importante para la gente, solamente porque la salud también es el sentido de orgullo que tienes de pertenecer a tu raza, de pertenecer a tu comunidad, de pertenecer a este país.
Sí,
Entonces,
sí, yes.
sí, sí, sí vamos a contactarlo nuevamente.
Ok,
Entonces,
muchas gracias, muchas
ahora nos
gracias.
despedimos y muchas gracias.
Ok,
Adiós.
adiós.
Bye. ¡Yay! ¡Lo hicimos!
Good job, Arely. Sí, muy bien, estuviste muy bien. ¿Ves lo importante que es hablar esas cositas chiquitas que teníamos
Sí.
para hablar? Yo creo que te sentiste muy cómoda, te veías
Sí.
muy segura de ti misma y eso me dio mucho gusto. Me dio-
Ok, qué bueno.
Ay, perdón, que se está grabando eso. Ah, ok. Ah,